Welcome everyone. My name is Nadia. Today I will be discussing a comprehensive risk assessment focusing on asbestos and talcum powder exposure and their link to ovarian cancer in women in the US. This assessment integrates all four elements of risk analysis along with public health and regulatory responses. Throughout the presentation, we will explore hazard identification, exposure assessment, dose response relationships, and risk management strategies alongside public health recommendations. Let's dive into it. Here's the structure of the presentation. We will cover an overview of ovarian cancer, hazard identification, exposure and dose response assessment, risk characterization, and risk management and public health implications. This slides provides introduction to the public health concerns regarding ovarian cancer and these materials, hazard identification to understand what makes asbestos and talc powder dangerous, and an exposure assessment to quantify how women have been exposed over time, dose response assessment examining how much exposure correlates with increased risk characterization to summarize the findings. Ovarian cancer is among the top 5 causes of cancer-related death in women. Figure 1 shows its ranking among causes of death in women born between 1946 to 1951. This highlights its public health relevance and the need of investigate environmental cause like asbestos and talc. Evidence has emerged suggesting that exposure to asbestos and talcum powder could potentially contribute to the development of this illness. The figure presented illustrates that ovarian cancer ranks among the top 5 causes of death for women alongside breast cancers and lung cancers. It is imperative to understand how this exposure may interact with ovarian cancer risk. Asbestos is classified as a group 1 carcinogen, while talcum powder, especially when contaminated with asbestos, is considered possibly carcinogenic. We will discuss how these substances interact with the body and contribute to cancer development. As we delve deeper into the materials at hand, it's crucial to recognize that asbestos is classified as a proven carcinogen by several health organizations. On the other hand, talcum powder is currently under scrutiny, particularly when it contains asbestos contamination. This contamination raises serious health concerns, especially among women who use talcum powders and its products, emphasizing the need to conduct through thorough risk assessment. Regulatory bodies globally agree that exposure to asbestos significantly increases the risk of developing ovarian cancer. This slide highlights the consensus among health organizations that has been built over years for research. The toxicological properties of asbestos are well documented, making the need for strict regulation even more apparent. Moving on to talcum powder, we see that it demonstrates potential carcinogenicity, especially when contaminated with asbestos. Many studies indicate that the risk linked to talc, especially in women using talcum products for personal hygiene, may warrant further investigations. It's essential to analyze this risk in the context of long-term exposure. This figure illustrates how asbestos can enter the body. Women may inhale fibers at work or at home through contaminated clothing or ambient air near factories. Once inhaled, fibers can migrate to the ovaries via the lymphatic system, where they remain and initiated harmful biological responses. For talcum powder, the primary exposure route is perineal application. This route enables talc particles to migrate to the ovaries. This figure illustrates the anatomical pathway through which talc may reach the ovaries. Talcum powder is typically applied in the perineal region. Um, this figure certainly shows that particles may travel through the vagina, uterus, and fallopian tubes to reach the ovaries. This transvaginal migration has been observed in pathology samples. Exposure to asbestos is quantified in fibers per cubic centimeters of air. Even low-level chronic exposure can pose significant risk. OSHA and NIOSH have established a regulatory threshold. Asbestos exposure is quantified in fiber years, which combines concentration with duration. OSHA sets limits at zero point 0.1 fibers per cc, but historic exposure were often much higher. The EPA now classifies asbestos as a hazardous air pollutants due to its long-lasting health impact even at low doses. Talc exposure depends on uses, frequency, and duration. Cultural and socio-economic factors influence exposure patterns. Long-term habitual use increases cumulative exposure burden. Surveys shows that 30 to 50% women have used talcum powder genitally. African American and Hispanic women report higher usage rates, often due to targeted marketing. This raises environmental justice concern too. A meta-analysis shows a nearly 80% increase in ovarian cancer risk in women with high occupational exposure to asbestos. These findings illustrate a clear dose-response relationship. Studies shows a clear dose responses among asbestos, that more asbestos exposure equals higher cancer risk. A meta-analysis found a standardized mortality ratio, which is called SMR, of 1.77 for ovarian cancer in exposed women. This supports the conclusion that asbestos not only causes mesothelioma but also ovarian tumors. Talc shows a modest dose responses with a higher risk associated with prolonged and frequent use. African American women in particularly shows a 44% higher risk based on exposure data. Combining the evidence from hazard identification, exposure assessment, and dose response, we conclude that asbestos presents a definite risk. Talc, though less conclusive, also warrant concerns due to widespread exposures. When we put the pieces all together, asbestos emerges as a high-risk carcinogen with no known safe exposure level. Talc presents a lower but still significant risk because both products were widely used. Even small increases in risk translate into substantial public health burdens. In 2024, the EPA finalized a ban on chrysotile asbestos. Workplace protections have been in place since the 1980s, but enforcement and compliance still vary. NIOSH advocates for zero exposure where feasible, acknowledging that even low levels pose cancer risk over time. The FDA has tested talc-based products for asbestos since 2019. After the contamination was found, companies like Johnson and Johnson recalled their products and transitioned to cornstarch alternatives. As of 2023, FDA testing has shown improved compliance through no US ban exists yet. Agencies such as IARC, EPA, and FDA have provided guidance on asbestos and talc. While asbestos has no safe ADI due to its carcinogenicity, talc use in the genital area is discouraged. Asbestos has no acceptable daily intake due to its potency. Talc regulations is looser, but agencies urge cautions, especially for genital use. IARC and FDA both recommended asbestos-free certification and consumer labeling. Future policies may strengthen these guidelines. So, public education campaigns from the CDC and American Cancer Society advise against genital talc use and promote workplace safety regarding asbestos. Outreach through social media, community health workers, and clinical setting helps translate science into preventive behavior. So minority and low-income women were disproportionately targeted by talc marketing. Similarly, blue-collar communities were exposed to asbestos through legacy industries. So to stay informed, credible sources would be include the FDA, EPA, PubMed, and IARC monographs. These resources are essential for understanding chemical risks and regulatory updates. So to conclude, asbestos is a proven carcinogen and talc shows probable risk. Regulations, awareness, and product reformulations are essential for reducing future ovarian cancer cases. Thank you for your attention. If you have any question, please feel free to ask.